acute painless vision loss. There are so many things that can go wrong with the eye. And when I was in residency, thrown into ophthalmology call, I was petrified that I was going to miss something on call, just felt all over the place, and it was overwhelming. But then I came up with a mnemonic, and it was a game changer for me. And I still use this when I'm on call. Don't worry about taking notes. I want you to relax. Take this moment for yourself. And if you want a copy of the notes, you want the mnemonic, just click the link in the description below for a downloadable copy. So the mnemonic is Don's cigar. So for the record, I don't endorse smoking. This is how the mnemonic came together, and I've been able to remember this 2-word mnemonic for years. So I want you to actually write the mnemonic. This is actually a V, so think of it as an upside down A, and then put parentheses around the O and the S. The reason why I put parentheses around the O and the S is to remind myself that these diagnoses can often occur with pain, but they can also occur without pain. So that's why I included them in the mnemonic. The first letter, D, is for dislocated lens. A dislocated lens is where the lens that is inside the eye gets out of position. It could shift out of position, or it could literally fall to the back part of the eye. And this can happen for patients who have their natural lens, so patients who have not had cataract surgery, that have the lens that they were born with, as well as for patients who have had cataract surgery and they have an IOL, that's an intraocular lens, an artificial lens that's placed inside the eye during cataract surgery. Because the lens generally contributes about 1/3 to our vision, if the lens is really out of position or it's fallen to the back part of the eye, that can really affect a patient's vision. Now, there are many risk factors, just some I'm going to highlight. Trauma, as well as conditions that can affect the stability of the lens. Some examples are pseudoexfoliation syndrome, Marfan syndrome, and Ehlers-Danlos. The O is for optic neuritis, and that can present with and without pain. So I have a parenthesis around the O to remind myself that it doesn't classically present as painless vision loss. In fact, studies have reported that greater than 90% actually present with pain. There are patients who do have optic neuritis and they do not have pain. That typically falls under the atypical optic neuritis, occurring in less than 10% of cases. So that means about 1 in 10 optic neuritis patients are going to present without pain. And if you're thinking that every single optic neuritis patient has to have pain, you could miss that diagnosis. So that's why I included it in Don's cigar. N is for non-organic visual loss, aka functional visual loss. And so that's where there's a subjective decrease in visual acuity or visual field where there is no organic cause identified, or not one that can explain the patient's symptoms. The S stands for stroke, specifically a cerebral stroke. So this is the second letter in the mnemonic that has parentheses around it, because a cerebral stroke may or may not lead to eye pain. Something to keep in mind is that when you're seeing the patient, they may not be endorsing any eye pain, and maybe the eyes look completely normal, but they might have had eye pain or discomfort prior to presentation. Because the brain processes visual function, a stroke can disrupt the visual pathway and lead to vision loss that can present in different ways. So some examples include visual field loss, cortical blindness, especially if it affects the occipital lobe, as well as visual neglect, and that's where someone is unaware or ignores part of their vision. C is for central retinal vein occlusion and central retinal artery occlusion. The B, we're including its junior, so branch retinal vein occlusion and branch retinal artery occlusion. So just with the C in the cigar mnemonic, you're gonna get 4 more diagnoses. So when thinking about a central retinal vein occlusion and its junior branch retinal vein occlusion, as well as the central retinal artery occlusion and its junior branch retinal artery occlusion, let's make things a little bit simpler. So retinal vein occlusion, retinal artery occlusion. In a retinal vein occlusion, there's an occlusion of a vein and the blood can no longer drain appropriately. So everything gets backed up and there's a lot of pressure, and that can lead to the blood and thunder appearance that you may have heard of. So think of kinking up a water hose and everything gets backed up. In a retinal artery occlusion, there's an occlusion of an artery which then leads to ischemia. And this can occur due to an embolus, thrombus, or inflammation. A retinal artery occlusion is considered to be a stroke of the eye. So if you're seeing a patient in the outpatient setting, you're concerned that this is a retinal artery occlusion, send the patient immediately to the emergency department for a stroke workup. A smaller percentage of retinal artery occlusions can actually be due to GCA. So keep that in mind when you're evaluating these patients. Ask the questions, get the labs when indicated, and then go from there. The I is for ischemic optic neuropathy, or ION. Ischemic optic neuropathy occurs when there's impaired blood flow to the optic nerve, and that can lead to vision loss. There's two main categories, an AION, or anterior ischemic optic neuropathy, as well as PION, posterior ischemic optic neuropathy. So anterior ischemic optic neuropathy, this involves the anterior aspect of the optic nerve, specifically the optic nerve head. So when there's decreased blood flow to this area, that can lead to vision loss as well as disc edema, which you commonly see on exam. What I'll briefly mention about AION is that there's two main diagnoses to keep in mind, and that's NAION as well as GCA. So NAION, that's more common than arteritic anterior ischemic optic neuropathy. The buzzword for NAION is disc at risk, and that's where the cup to disc ratio can be less than 0.3. So the structures traveling within the disc within the optic nerve can be more crowded. So one way that you can remember that and differentiating between the two, this starts with an N. There's not enough room. And for arteritic anterior ION, GCA, GCA, GCA. This is a no misdiagnosis. The optic nerve has a classic pallid edema. It's a chalky white appearance of the optic nerve. AION is more common than PION. In posterior ischemic optic neuropathy, there's hypoperfusion of the posterior aspect of the optic nerve. So that's why on exam and in the acute setting, you're not going to see disc edema. In fact, many times, other than a relative afferent pupillary defect, the eye may look normal. An interesting type of PION is perioperative ischemic optic neuropathy. And this is where there's inadequate blood supply to the optic nerve that can lead to vision loss. It's believed to be multifactorial, but some risk factors include significant blood loss, prolonged intraoperative hypotension, and prolonged anemia. Patients often wake up from surgery with profound vision loss. It can be unilateral, but it's often bilateral. Even saying that, I remember when I was in training and I was consulted on a case where a patient woke up from surgery and had no light perception vision in one eye, and there's no pain. The G in Don Cigar stands for giant cell arteritis, or GCA. It's also known as temporal arteritis. I have the I and the G linked together because giant cell arteritis is a type of ischemic optic neuropathy like we just went through. But the mnemonic would sound weird without the G, so now you have two reminders to not miss GCA. The V stands for vitreous hemorrhage, and we often use the acronym VH in our notes. A vitreous hemorrhage is when there's bleeding inside the eye, specifically in the vitreous cavity. This can lead to significant vision loss. I've seen patients on call and they have hand motion vision, and it's due to a vitreous hemorrhage. The last letter in Don Cigar is R, and that's for RT-RD, which stands for retinal tear, retinal detachment. Commonly, patients present with an acute onset of flashes of light, floaters, and or a curtain or veil. The vision can be pretty good, or there can be significant vision loss. What can make things a bit difficult is that sometimes the patient's symptoms are not that dramatic. They may just have a couple new floaters, but they fit in the demographics of an acute posterior vitreous detachment, a PVD, which can put somebody at risk for a retinal tear or detachment. Or they could just have a couple new floaters and they do have retinal pathology, or they may not. And it's just floaters that they're noticing, and it's a normal process of aging. Risk factors include trauma, aging, a posterior vitreous detachment, prior eye surgery, family history, high myopia, and metastasis. So metastasis, just a quick comment, that can lead to a serous retinal detachment if there's cancer that spreads to the eye. So a quick recap: Don Cigar is the mnemonic, D is for dislocated lens, O optic neuritis, N non-organic visual loss, S stroke for cerebral stroke, C for central retinal vein occlusion and central retinal artery occlusion. Don't forget the juniors, branch retinal vein occlusion and branch retinal artery occlusion. I for ischemic optic neuropathy, or ION, G for GCA, giant cell arteritis, V vitreous hemorrhage, R for RT-RD, retinal tear, retinal detachment. If you found this to be helpful, please share this video with someone. Like, literally click that share button and send it. It only takes a few seconds. Acute painless vision loss, automatic, Don Cigar. Boom. And now all of a sudden things get a little bit more, dare I say, clear. The ophthalmologist making an ophthalmology pun.